My name is Christine Olsen. I'm at Oregon State University. And first of all, actually, I would just want to say, please pardon me if I have to clear my voice or anything. I'm getting over a cold, and thankfully I got my voice back for today, because this would have been difficult with charades. So I am a research social scientist. I specialize in fire. And so I want to just acknowledge that this conference has been really wonderful for me, and I'm sure many of you feel similarly, but I am in a specialty where we usually go to conferences with fire people and social scientists. And so to be here among such a diverse breadth of disciplines and managers and students, it's been really wonderful. I've greatly enjoyed the conversations. I want to acknowledge the Great Basin Fire Science Exchange and the Northwest Fire Science Consortium for together helping fund my trip here. And they have a table in the lobby. If you haven't had a chance to stop by, I encourage you do so. Okay, and there. So I can't go further without saying that this is not just my work. I work with a number of other folks and a number of different funding agencies. So Dr. Eric Tolman at Ohio State has been central in a number of the projects I'll be talking about today. Dr. Troy Hall from the University of Idaho, who actually now is at Oregon State, also key in a number of the projects and ideas presented. Dr. Jared Blades, Jeff Klein, and Tom Spies from Wisconsin, and then the Pacific Northwest Research Station of the Forest Service have all been key, and we've had a number of student researcher assistants as well. The primary funding for the work I'll be talking about today has come from the Joint Fire Science Program. We've also had funding from the National Science Foundation, the Western Wildlands Environmental Threat Assessment Center, and then contributions from all of our institutions and our local consortia. So just a quick overview. I'd like to give a brief introduction to smoke and to the projects that I want to share with you. And then I want to talk a little bit about agency perceptions of managing smoke, a little bit about communication, because we're talking about smoke and managers managing it and people having to experience it. So there's a lot of communication going on between them. And then, or there should be a lot of communication going on between them. We'll find out that doesn't always happen. But, and finally, some public perceptions of smoke, both experiences and then their perceptions of what we should be doing. But why am I talking about smoke? Just to make sure we're all connecting the dots. But restoring the West, when we're talking about fire, of course, means there's going to be smoke as well. And if you're in the fire community, then you know or are very familiar with the trade-off discussion around, well, we have big wildfires, and one mechanism for trying to reduce the risk of future big wildfires is to use prescribed fire. Big wildfires generally produce big smoke. Prescribed fires, hopefully, usually produce less smoke, and we can control the conditions around when that happens. But, you know, a lot of people just don't want to smoke at all. So if we come to them and say, there needs to be a burn, an intentional burn, and they say, well, you're intentionally putting smoke in my face, and that's not okay with me. So this is part of why this conversation is so important when discussing restoration in the West. Smoke has a lot of impacts. It's not just health. I'm curious, though, quickly, statistically, a third of you in this room have some sort of a respiratory condition yourself or with someone in your family. And so let me ask you, I know you've had smoke in this community and other parts of Utah. When it's a heavy smoke day, do you feel it? Shake your head. And there's a lot of nodding. It's a real significant issue. And for some people, it is realized much more quickly than the lucky folks who have a healthier lung system. And it's not just the public. We are subjecting firefighters and fire managers to these levels of smoke all the time. There isn't a lot of research, actually, into the health effects for those individuals. It's starting, but there needs to be some more. There are also, let's see if that works. Yeah, visual impacts. And so this was last month, and that's Half Dome in Yosemite, if you can see it. It can be things that interrupt aesthetic views that might impact tourism or recreation experiences, but it also can be smoke impacts blowing across highways and causing car accidents. I was actually driving through California when that smoke event was happening, and I was starting to wonder if they needed to close the interstate. It was very significant. And then something that we often forget to think about unless you're a farmer, is the impact it can have on crops. In particular, one area that's gotten quite a bit of attention is the impact smoke can have on grapes from wineries. There have been a number of locations in the United States and in Australia where entire regions have lost their entire annual grape crop. And so it has bankrupted a number of companies and leaves people scrambling. The wine still happens, it just tastes really bad. And then structural issues. So this actually is in my town. This is Corvallis, where I live. And those homes right there, certainly they were saved from that fire that you can see, but a lot of them had extensive smoke damage. It can cause staining. It can cause residues that continue to ooze out of the fabrics for a long period of time. And it sometimes is very difficult to document and prove when it comes to trying to get insurance to help you replace things that are damaged and destroyed. There are a number of others. This is just a quick overview of reasons why we worry so much about smoke. And when you're talking about smoke, the big, bad, evil part of smoke that hurts our lungs the most is PM 2.5. It's particulate matter 2.5. That is incredibly tiny, itty-bitty little tiny specks of smoke, of dust, essentially, of burnt material, many, many times smaller than a human hair that float around in the air. And they can get all the way into the deepest regions of your lungs and frequently don't ever leave. And so that's the primary mechanism that the EPA uses to track air quality and to tell us when we are not doing a good job protecting public health. They track it every day, all day long. And as you can see in Salt Lake City, this is our annual averages. 2014, they had a fewer number of days where the air quality was deemed unhealthy for sensitive groups. So that's folks with asthma or other conditions. And at least down from the previous year. It varies every year, of course. But that's still a lot of days for people to suffer. Here's yesterday here in Logan. We're looking good. And I'm sure everybody enjoyed their breath of fresh air. Maybe not so much if you were in Southern California. But we're looking good right now, but then we have days like this, where this was in August, and I'm sure many of you smelled the fires in Idaho, Oregon, California, and Canada in late summer. And so there were parts of the country where they essentially wanted people to wear gas masks. It was really, really significant and very bad. And so we are always, these were wildfire, smoke events, and this is part of why, in terms of smoke, we want to try to prevent something like this. Like I said, the EPA tracks this stuff, and they just recently lowered the limit that they will allow on an annual basis across the country. And for places that are already struggling with air quality, kind of causes a big concern, a big freak out. Because once you're deemed out of attainment, then there are a number of restrictions put on your community, such as extreme restrictions on adding new industries or new businesses that might contribute in any way to pollution. And for struggling economies, that can be very difficult, where they are told for sometimes a decade, you can't bring in any new industries. The good thing is that folks are figuring out, with EPA assistance and local regulators' assistance, how to take steps to get to better air quality. And the EPA is projecting that even with the lower standards, by 2020, in 5 years, there will only be a small portion of California that is still out of annual levels of attainment. That doesn't take into account our big fire days, but annually. And so now, social science, which we haven't really talked about here today, in terms of fire research, is kind of new to the scene a bit. There were not many studies in the 90s. This graph actually only goes up to 2010, but you can obviously see a big increase in the number of fire-related social science studies, and it's continued to go up. But very few of them have anything to do with smoke. Most of them, if they do, it might be like 1 or 2 questions on a survey of 50 questions or something like that. There was one study that was specifically focused on understanding people's perceptions of smoke. And then two of the big findings they came out of it with were that the source of the smoke can matter, meaning if it's wildfire smoke, prescribed fire smoke, trash burning, whatever. But few people could actually distinguish accurately what kind of smoke it was. And so I want to share some results from a number of recent projects I've been involved in. I'm at Oregon State, and then I have a colleague at Ohio State, and we were looking at public and agency perceptions of smoke and smoke communication. And then in my institution, we had also a longitudinal piece, meaning that we took some of the data from our bigger project, went back to the same people a year later, and asked them identical questions after they had gone through a big fire year, and tried to look to see how their opinions had changed. In Idaho, they focused on looking at WUI versus urban communities in terms of smoke. And then the research with Oregon State and the PNW Research Station was actually looking at WUI homeowner mitigation behavior, but included some questions about smoke as well. And so our locations, primarily the northwestern part of the United States, and then a couple communities in the southeast. And the methods across all these studies, we collected data between 2011 and 2013. We did interviews with managers, regulators, community organizations, private burners, in some cases some nonprofits, in total talking to 60 people, and looked at that data for identifying key themes through a systematic analysis. And then we ran a lot of public surveys. We looked at the differences between rural and urban. We looked at WUI and urban, and then we also distinguished between intermix and interface, which are two different designations within a WUI. I'm assuming everybody knows what a WUI is. Yes. Wildland-urban interface. Sorry. All those projects sent out like over 10,000 surveys. That's a lot of envelopes to lick. And it's very tiring. You get very thirsty. So these are very typical response rates. If you're not familiar with social science, these are very typical response rates in natural resource fields, where we perhaps only hear back from like 1 in 3 people after repeated attempts trying to contact people to answer surveys. So if you get a survey in the mail, think about that poor scientist who's hoping you're going to answer, because it might be me. One of the things we do though is once we get back these answers, you got to ask yourself, what about all those people that didn't answer? Could they be different? And so we have some procedures for going to check and see if those people are different. And in all of these cases, we found there weren't any big differences between the folks who bothered to answer and the folks who didn't. And so some general information, actually this jumps back to the interview data, but some general challenges that the agency folks we had talked with identified were actually conflicts between the agencies on how they would manage smoke, even neighboring agencies. They identified a lack of resources, both in terms of people and in terms of materials that they felt they needed to manage smoke or to communicate around managing smoke. They felt the need for more internal support for the efforts they needed to go through in order to manage smoke what they felt was more effectively. They, of course, had significant concerns about liability if a prescribed fire was to escape. That's the ones we hear about in the news. There are like far more times per number of prescribed fires that don't escape and that go off perfectly, but we hear about the escapes in the news. This one is a photo from last month of an escape burn, and it's not just a concern about, well, what am I going to burn up if I accidentally lose my fire here? It's also, where's that smoke going to go? And even Mark Brunson has done some work on this as well here in Utah, where after a prescribed fire that got out of control, there was some significant smoke events in Utah, and they ran a survey to check and see how that might have impacted people's feelings about using prescribed fire in the future. And correct me if I'm wrong, but I recall you learned prescribed fire was still considered an acceptable tool, but there was a decrease in people's confidence in the agency to actually use it. So that's interesting. And then I mentioned hindered economies as well, not wanting to impact negatively upon communities where you live. Some needs that were identified. The need to be open and honest, particularly when it came to things you were not certain about or when you made a mistake. That is one of the greatest things that you can do to establish good relationships and to try to build trust with your community, is to admit mistakes and be able to talk about how you're going to address them and hope they don't happen again. The track record of personnel was also something that was identified, meaning that folks needed to stay in one community long enough to build up a relationship. And so people could then learn, okay, well, that guy, I know him, I see him, I've been seeing him for years, he's reliable, he hasn't lost a fire yet, I know, or he communicates well, like building up those relationships. And if agency personnel are switching out every few years, then it's not possible to build those relationships. Agency personnel also told us they really wanted more updated science. They want to get the results before us scientists go through that multi-year process of publishing. So events like this, where we can share things before they come out in journal articles, or other avenues like through the fire science exchanges with the Joint Fire Science Program, are great tools for helping get information to the managers who need it more quickly than the traditional academic scientific publishing process. They also wanted clear scientific guidance. There's a lot of pieces of fire management and forest management and range management where you got one scientist saying one thing and one saying an opposite, and that really is not so helpful. Sometimes people say you can find a scientist anywhere to say what you want, you just gotta hunt. And personnel wanted some clear guidance. They, of course, did not appreciate these conflicts. I wish a scientist could figure out the conflicts. They wanted the ability to update the public. In some cases, the agencies restrict them from releasing information until they have it as accurate as they think it needs to be. And in some cases, that just takes too long, and people need things more quickly. And all of them recognized they needed to be communicating more and doing more outreach. Acknowledged it from the front, like, we're not doing enough, and we know it. There were a few things in some of the specific locations that we went that I wanted to just mention as examples of how it does change by location. In our California sites, there was a lot of misunderstanding about how the policy of using fire worked. There were concerns about impacts on recreation and the economies in this location. The WUI there, it's very patchy and widespread, making it more difficult to project who may be impacted by smoke. But a positive was that they had a very active airshed coordinating group across all the agencies and all the big burners, where literally every morning they get on the phone and talk to each other and decide, okay, well, who's burning and where is the biggest need, because we can't all do it on the same day. In Oregon, there was a community, Klamath Falls, that was in EPA non-attainment status, which is a pretty significant, as I mentioned, hurdle. There was misunderstandings about policy. I personally heard folks telling me they didn't understand why this applied to wood stoves. They couldn't burn their wood stove in the winter, yet they saw the Forest Service up the road lighting off 1,000 acres, and they just did not get that connection. In many cases, it wasn't quite that clear cut, but there was a lot of confusion around that. There was an open recognition that they were not communicating enough. It was just insufficient. They actually did have a escaped prescribed fire event that smoked out a town for a long period of time and caused very extensive loss in trust in the managing agency. People weren't willing to trust that they could manage it and keep it under control next time. There was a hope too that biomass may help them in that area to take care of some of the restoration needs that they had. There was a plant that was planned and is since halfway constructed and abandoned years ago. So unfortunately, that one hasn't continued. In Montana, they also did have a non-attainment community to worry about. There were some misunderstandings about boundaries because EPA boundaries aren't always where you think they would be. They don't always follow exact property lines. These folks in particular worried about cross-boundary smoke drift. They got smoke from Canadian fires all the time. And they, sometimes would light off their own fires and watch the smoke blow up to Canada. And it was amazing that there did not seem to be an international discussion across the border at the time. I hear it's gotten better. And they also did have their airshed coordinating group that helped them a lot. Now, thinking about communication, because if we're going to have these smoke events, and particularly trying to do prescribed events, we got to figure out how to do a better job with our communicating. And some of the challenges that the agency folks we spoke to identified were they were really uncertain about the effectiveness of their communication methods. Like, they've got some information, they want to share it, but how? What's the most effective way to do that? Who should they target? A bulletin board in front of the district office is not sufficient to reach everybody. So there were a lot of questions asking me what I thought was the best way to do it, and we're trying our best to figure that out through this type of work. There were often conflicting and confusing messages. This particularly came up in the Southeast. I've got these pictures up here just as an example, but it can be very confusing to folks in the general population when they see billboards or commercials about how fire is good. We need fire in our ecosystems. It helps the animals. It helps the planet. And at the same time, you've got Smokey Bear out there reminding you, there's babes in the woods. Try not to let your fires go. And so for many people, it's a very confusing. And then there was some concern about internal priorities, as I mentioned earlier, people needing more resources, needing more internal support, needing this communication really to be a priority, recognizing that their relationships with their communities were extremely important. And some ways that people were addressing these challenges. There was a lot of talk about consistent and coordinated management across boundaries, not just land management, but also smoke management and communication management. And so all levels of figuring out how this whole event of a prescribed fire or even a wildfire event would be handled, that they just needed to be talking to each other a lot more. Improving communication in terms of making it that institutional priority, coordinating those messages across and within the agencies, utilizing social networks. For example, in a lot of communities, there is some sort of community group that looks at forest restoration, or sometimes there's fire management or like fire awareness or fire-wise communities, things like that, if you've heard of some of these terms. Reaching out to those entities, because they often have big mailing list, and they have people that they know, ways that they know how to get the word out much more quickly than an individual, public affairs officer or district ranger would be able to do. So taking advantage of those networks. And then optimizing resources, digging the billboards out of the closet, and though they aren't the most effective way to spread a message, having a message spread in a number of ways is one good way to reach as many people as possible. And then fostering relationships with the public, including trying to engage in person, and then getting involved in partnerships, because these gave people the opportunity not only to have two-way conversations and ask questions, but to build relationships and to share ideas. And that was particularly important in some of the smaller communities where at times they had started with fairly adversarial relationships. And so now thinking, okay, well, we talked a lot about the agency perception and communicating with the public. What do the public know? And so basic knowledge question, like, well, have you ever heard of this or read about it? Prescribed fire, smoke impacts, fire use, and fuel reduction. Largely, yes. Most people have heard of these things. And then we say, okay, well, how about communicating? When you get messages from the agencies or other places when you're about smoke, how well do you think they're doing? Are they giving you the best available information? Are they giving you timely information? And are they giving you enough smoke information? And largely the answer was no. These are people who disagreed that they were getting the best info, that's timely info and enough information. So 30 to 40%, no, not getting it. We asked people, okay, you want some information, how do you want to get it? What are the ways that folks can communicate to you that you will get and that you will read and that will be useful to you? And this is ranked here, sorry that it's a little small, ranked here in order of usefulness, the top being TV and radio public service messages. People believe those were the most useful to them. Pretty easy to receive. Most folks with a TV or a radio can get it. Incidentally, only the bolded ones, the public service announcements, families and friends, and billboards and road signs were experienced by even half of the folks. We did resurvey in some places after the fire in California and found some changes, increase in public service messages and a decrease in brochures. And we did not ask about social media. This was long enough ago that it wasn't quite the hot item it is now, and so a new study would certainly want to look at that. We asked about social networks and where people get information, and I'll just summarize quickly because I need to get through a few more, but the key outcome that we identified was that it was local experts that people were most likely to listen to and go to for information. Yet there were a lot of people who would apparently talk to no one. When people went to try to find information about smoke, more than half said they didn't have enough, they didn't feel that they had enough to feel safe. And that number increased after they had experienced a fire. Those who wanted to seek more information believed they didn't have enough. They already were using a lot of information sources, and they found it was difficult to find. And then asking about, okay, well, we talked about trust. Some events can really destroy trust. How much do you trust these agencies to manage smoke for you? And it was local folks, local departments of forestry, local forest staff, and local forestry consultants that had the highest level of trust, probably because of longer-term relationships in place. And then you head over to the right side where you've got EPA and the federal agencies in DC, and the levels of trust were much lower. No changes, though, in after fires in California. And then looking at how people rated the agencies for managing forests in general and smoke and reducing fire risk, and these were moderately good, roughly like a C, a grade of a C. Would you be happy with a C? It's maybe yes, sometimes. So obviously room for improvement, and the agency personnel we spoke to certainly wanted to improve that score. And almost all of them went down after a big fire experience, so we know it does make some impact. And then quickly to talk a little bit about people's perceptions of risk, we looked at a lot of items that might be risks people see. The biggest one that came out obviously was health. I want to look just very quickly at a few things about health and about impacts to scenery, because those were the ones at the top of the list. And so the important part to get out of this was, first of all, there's some differences between the places that we looked. And second, that people felt it was somewhat likely that they would experience a health impact from a smoke event. However, it may not be very severe, moderately severe. So again, some differences between the states though. And then looking at scenery, we had a similar pattern where there was some likelihood of experiencing an impact, but not terribly severe, somewhere in the middle range in terms of severity. And then finally, acceptance of smoke. What is acceptance of smoke? It's actually a pretty specific term in our field where people are weighing like the affective and cognitive issues related to different alternatives and deciding like, okay, I've weighed the pros and cons and I feel like that's okay. We're looking at sources of smoke. Most people said they could figure out the source, and most people said that the source of the smoke mattered and affected their acceptance of smoke. And so we looked at it for a number of different smoke source types. Most acceptable smoke came from a wildfire being suppressed at the top. A wildfire that was let to burn, had quite a much lower acceptance rate. And then you can see moderate acceptance on a number of the other types of burns. You also might want to pay attention, though, to the folks who disagreed. 25 to 30%, that's a lot of people who are in disagreement about using these tools and having to experience that smoke. We didn't see any change in California after the big fire events. And then finally, what influences acceptance? I've already mentioned a number of these things, but we found smoke, confidence in the ability of the managers to manage the smoke. That was positively associated with acceptance. The more confident they were, the more likely they were to accept the smoke. And the more risk they perceived, the less likely they were to accept. And then a few others had some smaller other variables that were influential. And so just to review, again, restoring the West with fire does mean we're going to deal with smoke. The agencies have a lot of challenges and needs. People generally say they just don't have enough information and they don't know where to look. Information could, if we wanted to provide more, address risks, trade-offs, outcomes, and agency competency, perhaps how successful you've been over time. Overall, the public is tolerant of smoke from all sources except for those with respiratory ailments. That was something that we looked at in these work as well. And smoke acceptance was most influenced by risk and confidence in the agency to manage it. And so I think I went pretty long, but I'd be happy to take questions.